All right. Good morning and welcome to the HIV Prevention and Education Virtual Summit presentation entitled HIV 101. Today we are joined by Teresa Sullivan, Director of HIV Prevention and Education here at Philadelphia Fight. Before we begin, I'd like to go over a few reminders. Viewers, please make sure your mics are muted. The chat box is disabled, but you can ask questions using the Q&A box located at the bottom of your screen. Reminder, this presentation is being recorded. A Q&A will take place at the end of the presentation. At this time, I will turn it over to our wonderful panelists so that we can begin the presentation. Thank you.
Thank you so much, Kat. So as Kat said and mentioned, my name is Teresa Sullivan. I use she and her pronouns. I am the Director of HIV Prevention and Education here at Philadelphia Fight. So before I begin my presentation, I want to give you who we are as Philadelphia Fight. Philadelphia Fight has been around for 30 plus years in the community doing the work for people living with HIV and anyone living with any chronic illness that needs our support and health care. Philadelphia Fight is a community health center providing culture and competent and comprehensive primary care. Members of the community of low income can get their care here at Philadelphia Fight regardless of the ability to pay. We also have research. We also engage in community education, advocacy, social services, and outreach to people living with HIV and those who are highly impacted or at risk, including family members, communities with high rates of HIV in their community, and formerly incarcerated persons, young people at risk, and access to most advanced clinical research in HIV treatment and prevention. Next slide. So today I am going to cover a couple of things. I'm going to give you a basic 101 HIV. HIV and AIDS, they are not the same, and we will discuss how they are different. HIV treatment and prevention, what are our treatment methods, and what are our prevention methods that we need to make sure that we're incorporating in our community, in our organizations that serve people living with HIV. HIV testing and how that empowers our community, treatment for HIV services that we have here at Fight, and new prevention methods, including U equals U, PEP, and PAP. Next slide. So what's so interesting about this slide is we still see a high number of people living with HIV globally. In the world, we have 37 million people living with HIV. In the United States alone, we have 1.1 million people living with HIV. In our city here at Philadelphia, we have 19,113 people living with HIV. This is proof positive that HIV still impacts a significant number of people globally and also in our city of Philadelphia. Next slide. So what is interesting about this map that you're looking at is the overlap of the most all at-risk issues in Philadelphia neighborhoods, from poverty, violence, high school dropouts rates. HIV is a disease of poverty and health disparities. HIV is a symptom of a larger problem that we have in our community. And until we address those issues of social disparities and social determinants of health, we will never end this epidemic. In almost every area of Philadelphia, we will find someone, some resident living with HIV. Next slide. So what is HIV? Now, I'm going to talk about the clinical definition of it here today. HIV is an acronym. It is human immunodeficiency virus. Let me break that down. It happens to humans. Immuno means your immune system and the deficiency of your immune system to function well if HIV is present. And it's simply a virus. It's a virus that weakens your immune system over time. Next slide. So HIV in the body. We talk about CD4 cells. You might have used the word T cells, helper cells, a type of white blood cells, AKA immune system cells in the body. T cells are actually a genetic term of all the white blood cells made up in the thymus. And we all have our thymus in our bodies. So instead of helping to keep germs out, HIV turns our immune system that protects us from germs and diseases into HIV factories over time, once it enters into the bloodstream. Next slide. So, breaking it down, remember HIV is a virus. AIDS, however, is a diagnosis someone gets only after having HIV and has severe weakness of the immune system. And it stands for acquired immunodeficiency syndrome. And that breaks down sort of like HIV does too. You have to acquire it. No, and that means even for people who are vertically transmitted, they acquire it. The immunodeficiency means your immune system, and deficiency means the weakening of your immune system, and the collection of things stands for the syndrome. You can have HIV and not AIDS. Everyone that gets an AIDS HIV diagnosis does not necessarily will come down with a diagnosis or an AIDS condition. They are different. You can't have AIDS without having an HIV diagnosis. A lot of people get confused about this. So I want to be real clear that in order to have an AIDS diagnosis, you have to have AIDS first. And it's not necessarily a crystal ball that you are going to get an AIDS condition if you have HIV, especially with the new advancements of medications that we have today. Next slide. So the clinical definition of what is AIDS. What does it mean for a person to have AIDS? AIDS diagnosis means you have to have a CD4 count, which I talked about just a minute ago, and the CD4 counts are in our blood, in our system, under 200. Or, and that's the key word here, or an opportunist infection from the CDC list. We'll talk more about that as I go through this presentation. The opportunist infections are infections that are using the opportunity to weaken one's body and the immune system, so that way the HIV can flourish and continue to make copies of itself. OIs for short, sometimes are required and called AIDS-defined illnesses or HIV-related illnesses. Doesn't mean that everyone's going to get a OI. There's no crystal ball that says that, again, a person that gets HIV is going to acquire an AIDS diagnosis. And that's why treatment is very important at the beginning when they get tested for it. Getting people on treatment will impact someone from not having an AIDS diagnosis. Next slide. So how do HIV progress to AIDS, right? So there's several stages. There's the acute stage, what we call the primary infection stage. That happens when between 2 and 4 weeks of the initial infection. You may have like flu-like symptoms. You might feel like you had the flu. High amounts of virus is in the body at this stage. And then we had the asymptomatic stage, which is also called chronic infection. It's called clinical latencies. You feel fine, you feel healthy. However, HIV is in the bloodstream at this point, damaging your immune system at this point. And the symptoms are very developing towards outwards for any kind of more infection inside the body, have a high viral load because treatment is not present at this point. Then, and within 10 plus years, someone could, and my key word here, could, advance to an AIDS condition. This is different for everyone. There's no crystal ball that's going to say who's going to require an AIDS diagnosis. That is why it's very important for people to be connected to the provider, adhering to the medications that are prescribed, right? So, but keep in mind that it's not necessary that someone is going to go from having an HIV diagnosis to acquiring an AIDS condition diagnosis. There's no crystal ball that tells us that. Next slide. So HIV transmission. There's a lot of myths about how HIV is transmitted. So today I want to give you the facts. And now I'm going to talk about some of the myths later on in this presentation. HIV only can be transmitted through blood, vaginal fluid, semen, pre-cum, breast milk, and rectal fluids as well. Your skin has to be broken in order for HIV to get into your bloodstream. HIV cannot get into a healthy skin that is not broken, but it can get into broken skins inside what I like to call your mucous membranes, which will allow in your mouth and in your anus, and blood can get in that way. So one of the things that HIV infection fluids have to get into your bloodstream, keep that in mind. The example of that I just stated is getting blood on your hands versus getting blood in a cut on your hand. Next slide. So here is some casual contacts about myths of how people can acquire HIV. These are myths. HIV can be acquired through casual contact and sharing items with a person who is living with HIV. These ones on this slide you see are very much so myths. And we want to dismantle all the myths that start causing so much stigma about people living with HIV in our community. And I will talk more in this presentation about how to do that when we're talking about dismantling stigma in our communities. Casual contact includes hugging, kissing, shaking hands with someone, eating from the same plate. The mosquito bite has always been one thing that I heard so much in the community that transmits HIV, which is a very much so myth. Coughing, sharing toilet seats, other kinds of seats, computer equipment, touching something like a pen or pencil, eating utensils, and public bathrooms. These are all myths of how HIV is transmitted. I just mentioned the facts about how the fluids that transmits HIV. These are ways that we impact people with myths and stigma by believing that HIV can be acquired from casual contact. It cannot be done that way. Next slide. So primary prevention is the key, and we're going to talk about the primary prevention, stopping HIV from the beginning of to acquire it. Now that you have a little bit more information about transmission, we can talk about how individuals can protect themselves from acquiring HIV. This is called primary prevention. The top of the triangle that you hear on the slide. When we stop a person from getting a particular disease or illness, this is called primary prevention. What are some everyday examples of primary prevention? One is universal health care is washing your hands. Another example is to prevent people from having winking bones is drinking milk that has vitamin D in it. Another one is to keep people from having cavities is to make sure we have fluoride in our water, fluoride in toothpaste nowadays, to prevent severe illness and injuries to individuals driving. It is the law to have a seatbelt in your car. To prevent obesity and heart disease, right? We want to encourage people to exercise, change their diet. Those are preventive measures that we can take, and those are things that we do on-set primary prevention. Next slide. So HIV prevention. We have a lot of tools today that we didn't have in the early part of the epidemic. We have Prevention Point of Philadelphia, which is located at 2913 Kensington Avenue. We want people to avoid sharing syringes, get clean needles, because clean needles save lives. You can get those clean needles at prevention point, and now today you can go to your pharmacy and require some clean syringes. We want to make sure that people are not injecting with same needles when they're doing drugs, taking hormones, taking insulin for diabetes into their bodies. So we want to make sure that people have access to clean needles. I can't say it enough that clean needles save lives. We want to make sure that we are using barriers such as condoms during sex, whether it be the Freedom condom, the FC2, the assertive condoms for females, those who want to use those, but it's versatile too. So it doesn't matter what gender you are, you can use that condom as well. Dental dams, right, for oral sex. These are prevention barriers that we can use and incorporate to keep us from acquiring HIV. And also can help, some of these tools can help people from not getting STIs, which is also a big problem. Feeding infants formula. We rather in this country have babies have formula instead of being breastfed if a woman or the person is living with HIV. In other global countries that are not having access to formula, one of the things we're working on is to make sure they do have access to treatment, right? Because the more you're on treatment, the more you can lower the viral load inside all those body foods I talked about, such as breast milk, then because they don't have the option to go to a store and get formula. But we're working on a pathway, which I'm really excited about breastfeeding. When the mothers who are positive can still breastfeed and still not transmit HIV to the infants. Next slide. So what is PrEP? It's an acronym too. You're going to hear me talk about a lot of acronyms today in this presentation, but I'm going to break it down for you. So pre-exposure prophylactics is a once pill, once a day. It's called Truvada. And this is 95% accurate from people acquiring HIV if taken properly and adhered to, right? Just like anyone living with HIV, their medications work when they take them and when they are in the body and when they adhere to them. Same thing with PrEP. You have to adhere to it and you have to take it, right? HIV negative individuals who think they have been exposed to the virus can talk to their healthcare providers to get on PrEP. And I'll talk about more about what we offer here at Philadelphia Fight when it comes to making sure people who want to get on PrEP. PrEP can be used along with other sexual practices and tools. We do not throw away those tools because we want to make sure people don't also acquire, like I said earlier, STIs, sexual transmitted illnesses, right? But the PrEP is only going to work for HIV. Most insurance cover PrEP. Patient assistance programs are out there to assist people on getting on PrEP. And I'll talk more about how we do that here at Philadelphia Fight, make sure people have access to PrEP at lower cost or no cost. Truvada for PrEP is approved for all people, regardless of their sex or gender, who are HIV negative. Next slide. So how does PrEP work? The HIV life cycle is just what you're looking at. HIV replicates itself, making copies of itself in the body. It latches itself onto the immune system T cells, also called the CD4 cells. After this occurs, the HIV cell is able to replicate itself in the process, making more copies of itself and damaging the immune system. The T cell or the CD4 cell is no longer able to fight off the infection. Next slide. So Again, how does PrEP work? As you see on this slide, you see PrEP at the top of the CD4 cell, which is also called the T cell. PrEP works by creating a barrier between HIV and the T cell, which protects this T cell and doesn't allow HIV to insert itself into the cell to make copies. It stops it. This is what we call the life cycle. But it stops it from right from the beginning, from not able to attach or fuse itself to the CD4 cell. PrEP is also able to protect for semen fluids, cervical fluids, and rectal fluids, and vagina lining cells from HIV cells. When the HIV cell cannot replicate itself, it's unable to weaken the immune system because it's no longer there. So this is PrEP is a great tool that we promote at Philadelphia Fight for people who are negative and want to get on PrEP. Next slide. There's still, unfortunately, some myths about PrEP. One of those myths is, isn't it a drug for everyone like me? Is it a drug for anyone who wants it? If I'm acquiring a new HIV diagnosis, anyone can acquire HIV, right? So therefore, we're making sure that any negative person wanting to get on PrEP has access to that. So the myth that is not for you is a myth. It's available to anyone requiring it to keep from acquiring HIV. Another myth, as we heard so often, is the encouraging unsafe sex practices or behaviors. And so many studies we have studied with people already on PrEP, those studies and those evaluations have proven and shown that there was no increase of risky behaviors and what I like to call risk to reason behaviors of acquiring HIV. Next slide. Common myths about PrEP. Again, we got some more here. If PrEP there's no need to use condoms. If you're on PrEP, remember I said earlier, PrEP is for people negative to keep from acquiring HIV, right? But it doesn't stop you from getting STIs. It doesn't stop you from getting pregnant, right? If that's what you don't want to happen for you, right? So PrEP is only going to stop HIV from being in your body and you're acquiring it. It's not going to stop you from practicing safer sex practices. That is a tool that you have to learn. And we have tools to make sure that people can do those kind of things right here at Fight. Another myth is PrEP leads to HIV medication resistance. Let's break that down. In order to have resistance, a virus has to be present in your body. If you're taking PrEP to prevent the virus from getting in your body, then there's no virus, right? So therefore, there's no resistance. Resistance only happens in the presence of a virus. So we want to make sure that people go on PrEP. So there is no virus, so there is no resistance, right? Resistance can only occur in the presence of a virus inside the body. And that's what every virus. It has to be there in order to have resistance. Next slide. What is PEP? Non-occupational post-exposure prophylactics. Typically, it is provided if you have a real exposure that has, like, for example, of unprotected sex with someone you know they're HIV positive, had an accidental needle stick, or someone you know is HIV positive and typically doesn't get prescribed if you are having a one-night stand, right? So we have some guidance around getting on PEP. If you know that you have been exposed to HIV and would like to get on PrEP, there are several ways to get that medication. If you're insurance, you can try going to the emergency department. I encourage that right now in the middle of COVID. I encourage you to talk to your provider. And if it's an accidental needle stick on the job, talk to your supervisor about getting on PrEP. If you don't have insurance and want to get PrEP from FIGHT, you can contact our PrEP team through the hotline, and they will link you to the PrEP service, and you can walk into our John Bell Clinic. There we will likely be a wait time, but if you make it clear that you have been need to be on PrEP, staff will make sure you are seen that same day. So we are making sure that people, again, have access to the things they need or preventive medications when we're talking about HIV. And again, it is Truvada medication once a day. People have to take it as prescribed. It needs to be taken within 72 hours of initial exposure. The sooner the better. It's taken by mouth. It is a pill. And again, it helps prevent the virus from entering to the CD4 cell and replicating itself. So the sooner you know you have been exposed, get your PrEP from us, from John Bell Clinic, or talk to your supervisor or the health department if you feel that you have exposure to HIV. Next slide. So prevention is always the key when we're talking about any virus or any bacteria or any illness or any diseases. So when we have all these great prevention methods, why is there still people still requiring HIV? I said early on in this presentation that HIV is a symptom of a larger problem in our communities, and that is social disparities and social determinants of health, where people don't have access to housing, where people don't have access to education, where people don't have access to food, and people who have low literacy and don't have access to those kind of services. It's a larger problem, a thing that are happening in our community that we must address in order to end this epidemic in a lifetime of people living with HIV. In an ideal world, HIV infection would be preventable, but we do not live in an ideal world. HIV acquisition is greatly impacted by poverty, racism, homophobia, sexism, and access service. While these things exist in the world, individuals will be at risk for contacting HIV. When this happens, we can rely on early intervention services. It's the tool that we have now, which is in the middle part of this triangle. And beginning the continuum of care is what I'm going to talk about next, and how that impacts people. At the bottom of this triangle, you see crisis intervention, where we see people who didn't get tested, who got HIV, and they're at a stage where the immune system is very, very much damaged and may acquire AIDS condition. And we need to do an intervention at this point and get people in care. But we can prevent all that if we start at primary prevention, stopping the infection from beginning in the first place, and treatment also at that stage. Next slide, please. So the National HIV Strategy, we have a National AIDS Strategy, which is called the Care Continuum. The Care Continuum is a strategy to link people living with HIV to care and service and to prevent new HIV infections from occurring. The National HIV AIDS Strategy includes diagnosis, treatment, adherence, and addressing health disparities related to HIV, and improving and coordinating nationally to reach those goals. There are several pillars that we want to talk about, and this first one is all people living with HIV know their status. This is done through universal testing. More testing, sooner testing will help us with this care continuum and the strategy. Step 2, link all people living with HIV to treatment and care for their HIV. The sooner, the better, so that they can learn more about their status and how to prevent a crisis intervention. Step 3 pillar is once a person are linked to care, have them start medication or get them ready to start medication, which might include helping getting social support systems and services for those persons, such as housing, mental health. And step 4, support clients in their adherence to the medication to reach what we call undetectable viral load. And I'll talk more about that during this presentation. This might include linking people to adherence intervention programs or social services so that they might be able to get an undetectable viral load, more known as U equals U. And I'll talk more about that. Getting the virus load so low that it is less than 20 copies. That is one of our goals. Outside of all these efforts, there's continues to be a need to develop and adapt culture, representation in our programming. Because we need to meet people where they're at when it comes to their cultural beliefs and how they bring themselves to these services. So we have to make sure that we are being culturally competent and rolling out all our programs and meeting people where they're at to dismantle and address racism, poverty, homophobia, and remove barriers from all our programming. Continued funding and advocacy must happen if we're going to end this epidemic. Next slide. I said earlier on that testing is empowering. We want to get people tested to complete that first step in the care continuum. People need to know this HIV status. What is the only way to know your HIV status is to get tested. You can't guess that you're HIV positive. You must get tested. I mentioned that I have several clinics, John Bell Clinic. We have the Lax Center Clinic. You can go online to check us out, where you can get appointment to come get tested. Get tested, know your status. We also do counseling if you are positive or not about how to stay negative, and if you do get a positive result, what services that we can provide to you, such as social services, education around that, if you test positive, and what the next steps for you in your treatment goals. There's a list of sites in the Philadelphia website about testing, where you can go to where you, in the neighborhood you live in, to get tested. If that feels more feasible and makes you feel more comfortable. But know that at Philadelphia site, we will test you with no cost at all to get tested. Next slide. HIV treatment and prevention. It's important to go to a doctor who is an HIV specialist. An HIV specialist is a provider who sees 50 or more people a year in his practice of HIV. In Philadelphia, we have a lot of those specialists. We know that folks who are on treatment or viral suppressed have zero chances of transmitting the virus to another human being when they're connected to services. The System for HIV Medication course is available through the SPP program. It's called Special Pharmaceutical Benefits Program. You can get that as a way to offset some of the costs out of pocket for you. HIV Clinic Guide includes 50 HIV clinics right here in Philadelphia, including Philadelphia Fight. All people living in Philadelphia can get treatment when they test positive. No one should not have access, right? So we do that very well here at Philadelphia Fight. Next slide. So I said earlier on that I'm going to talk more about U equals U. Undetectable equals untransmittable. A lot of people think this is a new concept, and we're just talking about it more now. It was a concept in the beginning of getting on treatment, because what we knew then, that treatment would stop HIV from replicating inside the body and making your attacking and weakening your immune system. Now we call it U equals U, undetectable, untransmittable. What does this mean? People living with HIV who are adherent to the medications. Adhering to your medications is very important. And if you're struggling to do that, we also have that kind of programming here, right here at Philadelphia Fight. You can get to a point where you have HIV under control, a low viral load, 20 less copies inside your body. That's what that means when we talk about U equals U. U equals U means that they will not pass HIV to their sexual partners. U is a new message and research about HIV prevention. It is a tool. U stands for undetectable, untransmittable. If you have fewer than 20 copies of the virus in your body, again, you cannot transmit HIV to someone else. Undetectable viral load also dramatically reduces the risk of vertical transmission from mother to child. There's not enough information right today to talk about how it is about needles of sharing syringes. If you have fewer than 20 copies of the virus in your body, you will not transmit HIV to another human being. This is really important. This is how we are going to fight this epidemic, is getting those who live with HIV to an undetectable viral load so they do not transmit. And that we like to call it community viral load. Lowering the community viral load is one way that we can address ending this epidemic. Next slide. So right here, I'm going to talk a little bit more about U equals U and what does it mean. Transmission of oral sex or vaginal sex, yes. U equals U. Still consider using PrEP if you're negative and you're in a relationship or partnership with someone who is living with HIV. Use condoms for additional practices and protecting yourself from other STIs, sexually transmitted illnesses. Transmission, anal sex, yes. Still consider using PrEP if you're a person that's negative. Use condoms for additional protection. And other STIs, no. Remember, various methods can reduce your risk of STIs, sexually transmitted illnesses. That means that we don't get rid of condoms and tools like dental dam and condoms, right? We still keep those tools in our toolbox when we're talking about preventive measures that we have to take. Does it stop pregnancy? Absolutely not. Various methods, again, contraception needs to be used to protect against unwanted pregnancies. Mother to child's breastfeeding. Again, I said in this country, which we're moving forward in a different direction, hopefully in the near future, where mothers will be able to breastfeed their children. But for now, there are documentation cases of transmission from mother to child, which I like to say vertical transmission, and not mother to child, because that puts all the blame on the mother, right? And no one signs up to be a person living with HIV. Sharing needles, again, I said, if it's never recommended that you share any kind of needles, whether it's with needles for hormones, a lot of people might be taking hormones. Some people might be on insulin, got to use insulin pens or insulin, or just syringes, or even drug use. It's important that you go to the pharmacies, which they will give you syringes, and Prevention Point does it for free. Again, I cannot say enough that syringe and clean needles save lives, right? I know people might feel like, well, we are just giving people the opportunity to use or whatever. No, we're not. We're making sure that we are practicing what we preach, right? That prevention measures must happen and give access to people and meet people where they're at in their process. Next slide, please. U equals U. And the strategy works so well, then why are there still new people acquiring HIV? I know a lot of people are still asking that. And you'll see in this word cloud, resistance, healthcare, equity, side effect support, and we're going to talk a little bit more about why. Next slide, please. So the national strategy again, the care continuum. There are a lot of steps that need to happen and come together for a person to reach an undetectable viral load. As we seen and discussed earlier, we don't live in an ideal world. And there's still plenty of work that we have to do to end the epidemic. And we have to start when we talk about social disparities, social determinants of health, issues like housing, access to medication, mental health, mass incarceration. We must address those issues along the side of giving people access to treatment. They go hand in hand. They are interchangeable if we're going to end this epidemic, right? So that's why we're still seeing rises of HIV cases globally and right here in Philadelphia, because we need to get into the strategy that we have rolled out and applied in our communities and make it available, right? Will it happen overnight? Absolutely not. But we will begin to go down that pathway to make sure we're using the HIV strategy and to end the epidemic by addressing the social disparities that make people vulnerable to HIV in the first place, right? I said earlier on that HIV is a symptom of a larger problem. And those larger problems are those systemic things that are happening in our communities where poverty, balance, education, all mental health, substance abuse issues need to be addressed. More funding needs to be given into these programs so that we can end this epidemic, right? You can't do one without the other. So I cannot say enough about HIV is a symptom of a larger problem that we must address when we talk about social disparities and using a national HIV strategy. And it's written in there about those social disparities. Next slide. HIV stigma and HIV stigma continues to fool more people acquiring HIV. People may avoid getting tested for the fear of testing positive. People may not know or want to know the status or fear of dying, having to disclose their HIV status, the stigma that's still out in the world about living with HIV. Stigma is a significant part of HIV acquisition. What is stigma? It is a mass, a disgrace, or shame that's placed upon a group of people or community that are different. People may fear being associated with being gay, sex workers, or drug users, right? There's a lot of stigma and misbeliefs about people living with HIV. And this is another social disparity that's at the root cause analysis of why we need to get people tested, why people won't get tested, right? Because of this. It's HIV stigma still full of people acquiring HIV. Next slide, please. Again, HIV stigma affects treatment goals, getting people and keeping people in treatment. People living with HIV may not look for support for fear of being outed for in the community and by their peers. People living with HIV frequently experience microaggressions that reinforce HIV stigma and negative effects that, mental health, make adherence more challenging. Adherence is challenged enough, right, without the stigma. Be careful to never break anyone's confidentiality or disclose their HIV status. This can be a better harmful way and a worse and damaging to that individual, and you can put that person at harm's risk. Another way to address this is join community groups that support or advocate for people living with HIV. Be aware of your language that you use. For example, people living with HIV versus HIV positive person, clean versus dirty, put the person before the status and the condition of their health condition. Because when they acquired HIV, they were a person then, and they remain a person afterwards. We want to use people first language when addressing people living with HIV. Put the person first before the status, and don't break the confidentiality, and do not talk about the status without their permission, right? Those are the things that fuel a lot of stigma and can be very damaging and dangerous for many people living with HIV. And finally, get tested. Next slide. So Philadelphia Fight resources. We got here at Fight, we have prevention and treatment and community education. We have prevention, what we're doing right now. If you're here, AEM is Age Education Month in June. It happens every year, but we had to move it to virtual because of COVID. But we will get it back in person when COVID is no longer a thing that's impacting our communities and we feel more safe. But right now, we are doing our prevention summits and our education programs all online. They're coming back in person, and we're doing that rollback in a safe manner first. That includes our Teach Educational program, what I will talk about later on in this program as well. We do prevention right now. We have a very robust COVID testing site, part of Philadelphia Fight. And Jen White is one that's running our testing for COVID all around the city. We just got an award for it. And we are super proud of the work that comes out from Jen White with our COVID testing, because that is an issue right now. But HIV still remains an issue in our community, and we don't want to put that on a back burner. Next slide, please. So now I'm going to talk to you about some of the things that we have at Philadelphia Fight. We have John Bell Health Center. A little bit about John Bell. John Bell was an advocate and a founder of Teach Outside educational program at Philadelphia Fight. He was an African-American man who was a military man who had a vision that we need to not just treat people living with HIV, but we need to treat all kind of illnesses, right? He understood the intersectionality way before we started using that as a term, right? So the John Bell Center is a comprehensive healthcare center that provides state-of-the-art primary medical care for everyone, regardless of your HIV status. They specialize in providing quality care of individuals returning from prison or jail. So that's where we teach was dreamed of from John Bell, as chronic health conditions from diabetes, high blood pressure, any chronic illness that you may be living with, you can go to John Bell Clinic. And it's located at 1207 Chestnut Street on the 3rd floor. And there's the phone number right there, 267-725-0252. The John Bell Health Center. It is a program of Philadelphia Fight, because Fight is a community health centers. We are fellow qualified health centers. We have expanded and we have moved in the direction of care that fits the reality of our communities. Next slide, please. Jonathan Lack Center. Jonathan Lack Center practices primary care HIV medication for people living with HIV. It is housed the hepatitis C clinic, a special program for those living with HIV and hepatitis B or C. In other words, people who have co-infections. We are located at 1233 Locust Street on the 4th floor. And that phone number is right there on this slide, 215-790-1788. Again, it's on Locust Street. The Jonathan Lack Center is specific for people living with HIV or co-infected with Hep B or C. Next slide, please. Our YHAP Health Center is for young adolescents, people between the age of 13 and 24. The YHAP Center offers free to low-cost primary care and family planning service for young adults. They're located at 1207 Chestnut Street on the 5th floor. Their phone number is 215-344-1632. Again, it's for people between the ages of 13 to 24. Once they age out of that category, they can come over and continue to get their care at FIGHT at the Jonathan Lack Center, which is located at 1233 Locust Street on the 4th floor. Next slide. We also do dental care because we understand that we have to do what we call wraparound care, right? A one-stop shop where you can get all your care needs met at Philadelphia FIGHT, including dental. We are open to all patients, including people living with HIV. We also accept patients with and without dental health insurance. If you don't have dental health insurance, they can try to get you signed up for it. We also have a sliding scale policy. That means for people who are low income, where if they had to pay something out their pocket, it would be very low on a sliding scale based on their family income. And they're located at 1207 Chestnut Street on the 4th floor. And their contact is 215-525-3046. So make your appointment today. Dental is really important, especially for people living with HIV. Right? We have to keep our dental health, because it is dental health and it's part of your health care plan, right? Because we want to make sure people are eating healthy, right? Dental is important for everyone's all around health, right? So we do have a dental clinic that will see anybody, regardless of their ability to pay, and we will help them get their insurance. You won't see that too often in other clinics, but we do it here at Philadelphia FIGHT. Next slide, please. So step to PrEP. Just give us a call at the number that's right there, or send us an email at the email that's right there, prep@fight.org. If you're interested in getting PrEP as a person not living with HIV and you think that you have a risk to reason to do so, you can contact us, meet with one of our PrEP coordinators or a club, which is located at 1509 Patient Navigator. They will schedule an appointment for you with FIGHT and our FIGHT healthcare providers. Get a HIV test, get it every 3 months, know your status, so you can move forward, and whether it is positive or not, you can incorporate what you need to do to stay healthy and thriving. If you're a person that's negative and want to get on PrEP, PrEP is for everybody who desires it. It is regardless of your sex orientation, gender, race, you can get PrEP. You can get it right here at Philadelphia FIGHT. We have our PrEP line right there, again, in our email, right? So contact us if this is something that you want to do as an individual, or this is something that you want to do with your partners, right, who are negative, and you're a person living with HIV. Even if you are a person that has an undetectable viral load, use all the tools in your toolbox to keep people and to keep down what we call the community viral load. Because that's one of our main goals when we talk about ending the epidemic. Next slide, please. The Institute for Community Justice, short ICJ, their mission of ICJ is to create a stigma-free space with innovative prevention-focused programs that empower, educate, support people affected by the parallel crisis of HIV and mass incarceration, to protect the community health, raise consciousness around issues of social justice. They are located also at 1207 Chestnut Street, the 2nd floor, and their contact number is 215-525-0460. Contact them if you're interested in joining or getting services. If you have family members who are currently incarcerated or formerly incarcerated but still need services to navigate their lives after incarceration, the place to get all that information, get support services is the Institute for Community Justice. Next slide, please. Project Teach. Project Teach is an acronym as well, and it stands for Treatment Education Activists Combating HIV. It is an integrated health educational program which trains people living with HIV to act as peer educators, activists, advocates in the underdeserved communities hardest hit by the HIV pandemic. Low-income communities and communities of color. Teach focus not only on prevention, but treatment education, outreach, and advocacy. This is also a frontline Teach class available coming up soon, which will be on our learning manual system, where you can come into that system and do that program of frontline Teach at your own pace. But there will be places where you will get support even if it's online. So look forward to our frontline rollout coming soon. We're going to be so excited to offer this to people who are wanting to come into this field, caregivers of people living with HIV, because we want our caregivers to be informed how to take care of us, right? You know, especially as we are going to be the first generation of people 50 plus living with HIV, right? We want to make sure that they have all that kind of information. And that's located in 2 locations. One, Project Teach and Youth Teach is located here at 1233 Locust Street on the 3rd floor. And that phone number is 215-985-4448. For Project Teach extension, you want to reach out to Kat. Her extension is 377. And we are doing programming in July. We are not doing any classes right now, but we are recruiting for those classes. Next slide. So because we don't have this program really up and running anymore, I'm going to ask for the next slide. Critical Path Learning Center. Expansion of the AIDS Library and the Critical Path program. The Critical Path Learning Center is an educational comms area, stigma-free space developed to intersection of health and literacy and digital aid, doing our digital aid. They're located right here at 123 Locust Street on the 2nd floor. It says 3rd floor, but it's on the 2nd floor of that building. Technology access and training, adult education, employment resources, and hospitality services that we offer, from washing your clothes, amenity packets. Please get in contact with us if you need those things. And Robin has that up. Next slide, please. The Greater Philadelphia Resource Guide, we moved that guide to online, and you can find that guide at the website right here on this page at the aidlibrary.org, and that'll be available to you as well. And we update that every year. Next slide. Other services and agencies for people living with HIV. I'm not going to read all these, but we have case management, treatment centers, wellness services, emergency housing, legal services, food and clothing, and advocacy and activism, community building, and education and job readiness at all our programs, in addition to our prevention and treatment for our community members. So I'm going to just leave it up there. So if someone wants to get all this information, we have the AIDS, ACO, Institute for Community Justice, BIPOM, Philly, Penn, Silwam for wellness for people living with HIV, the AIDS Law Project, and Community Legal Services, ACT of Philadelphia, when we talk about activism and advocacy, getting involved, making a difference, being a change agent in your community. And Babashi, you can get all those services there that's listed. So take advantage of this, these services that are here for you. Next slide, please. So here's a slide that gives you some resources for the Fight House Centers. There go our website to the things I just mentioned, AIDS Law Project, AIDS.net, which is a great place to go get fact sheets and information to learn more about living with HIV that you can share with your community and family as well. PODS Magazine, AIDS Map, and body.com. Next slide. So I come to my bottom lines. Testing for HIV, again, is empowering. Protect yourself and others by using protective barriers during sexual activity. Use clean needles and worse because it saves lives. If you're living with HIV, use baby formula instead of breast milk. PrEP and PrEP can reduce the risk of acquiring HIV and can be accessed here, right here at Philadelphia Fight and other healthcare centers. U equals U is a new development in HIV care and treatment that helps reduce the impact of HIV stigma and reduce the risk of HIV transmission. There are many resources available in Philadelphia for people living with HIV and AIDS, and those at risk, like I like to say, risk to reason for HIV. Look and provide the folder for, we can get that information to you if you contact us again at fight.org. So I want to take the time to say thank you for listening to me on my presentation. And now I'm going to turn it back over to Kat for Q&A, questions and answers from our audience.
Thank you, Teresa. Wonderful presentation. All right, so at this time we have no questions. So to the attendees, if anyone has any questions or would like to say anything, you can put those statements into the Q&A box located at the bottom of your screen. All right, we have Glenda saying, great presentation. I learned a lot. Thank you so much. Thanks, Glenda. No questions, just thank you for the informative presentation. And Jeff said, is Teach being offered outside of Philadelphia?
Right, yes, that's a great question. So we do, and still working on and have done before COVID, what we call teach expansion. Teach expansion is done in the counties surrounding Philadelphia because we found that other agencies have heard about our teach program and they're like, oh, how did we do that, right? So what we're doing is we're offering other agencies at different agencies and counties surrounding Philadelphia the opportunity to have us come and do train the trainers at the agency and do a practice run of the program, how to implement it into their agency using their own demographics. And the good part about this also is that we get paid to do this and it's revenue, like for our program. So we're proud of that. And we're coming up on going back to the first place that we did it because they asked for us to come back. And when people ask you to come back, it's because you did a good job. Right? And especially because of COVID, a lot of agencies may have a turnover of staff and they want to make sure their staff had the same opportunity to hear about and how to implement our teach educational programs at their agency. So the answer, short answer is yes.
Wonderful, thank you, Teresa. And then Christopher Jones says, very educational. Thank you for your empowerment and resources. Thank you, Christopher. All right, any more questions, anyone? Kelly says, thank you so much. All right, we'll give it another minute. If anyone has any questions, please take the time to ask now. Thank you, Jeff. Great presentation. Will there be a printable version of this presentation, Teresa?
So there's not going to be a printable available, but what we will do, all our AEM webinars On our Cheetah website, we have a YouTube Cheetah website, where as we do these presentations, we will upload the recording of it. So if you ever need to go back and hear any of our webinars, you have the ability to do so on the Cheetah's YouTube channel.
Wonderful. Thank you, Teresa. Anyone else? All right, Teresa, I think that's all the questions we have.
Great. This is
All right. Oh, sorry, Teresa.
go ahead.
Thank you to our panelists, Teresa, for your wonderful presentation. Oh, 1 second. Hello, Teresa. Have not seen one another because of COVID. Oh, we have somebody named Evelyn Parker who is saying hello to you, Teresa.
Hello, Ms. Parker.
Teresa says hi. Oh, that's so nice. And thank you to all of our viewers for joining us today. And please join us for all of our upcoming presentations. Thank you all. Take care. Be safe and well. Have a wonderful weekend and take care. Thank you.
Bye, everyone. Thank you for attending. Sign up for those webinars.
Woo!